Hi, everyone. This is Nurse Anna from nursestudy.net, and these are 50 questions for diverticulitis and diverticular disorders. Hope you enjoy.
Would you like free audiobooks? Click the link in the description. Question 1. Pathophysiology of diverticular disease. A 65-year-old male presents with left lower quadrant abdominal pain, fever, and changes in bowel habits. You suspect diverticulitis. Which pathophysiological process best explains the development of diverticulitis in this patient? A. Increased colonic pressure leading to mucosal outpouching. B. Erosion of the diverticular wall by food particles. C. Hypersecretion of mucus in the colon. D. Ischemia of the bowel wall. Answer: A. Increased colonic pressure leading to mucosal outpouching. Rationale: diverticulitis typically develops due to increased colonic pressure that causes mucosal outpouchings, which then become inflamed and infected. Question 2. Initial assessment and signs/symptoms. A 72-year-old female presents with severe abdominal pain, nausea, and vomiting. She has a history of diverticulosis. What initial assessment finding would be most indicative of diverticulitis? A. Right upper quadrant tenderness. B. Left lower quadrant tenderness. C. Generalized abdominal distension. D. Rebound tenderness. Answer: B. Left lower quadrant tenderness. Rationale: left lower quadrant tenderness is a hallmark sign of diverticulitis, as most diverticula are located in the sigmoid colon. Question 3. Emergency interventions. A patient with known diverticulitis presents with signs of peritonitis. What is the immediate nursing priority? A. Administer oral antibiotics. B. Prepare the patient for emergency surgery. C. Insert a nasogastric tube. D. Provide the patient with a high-fiber diet. Answer: B. Prepare the patient for emergency surgery. Rationale: peritonitis is a surgical emergency. The nurse must prepare the patient for possible surgery to address the perforation and infection. Question 4. Medication management. A patient is diagnosed with acute diverticulitis. Which medication order would the nurse expect to administer first? A. Oral amoxicillin. B. Intravenous metronidazole. C. Oral ciprofloxacin. D. Intravenous acetaminophen. Answer: B. Intravenous metronidazole. Rationale: intravenous antibiotics like metronidazole are typically administered in acute diverticulitis to combat infection effectively. Question 5. Nursing care plans. What is a key component of the nursing care plan for a patient with acute diverticulitis? A. Encouraging high-fiber foods. B. Administering laxatives to prevent constipation. C. Providing clear liquid diet initially. D. Implementing strict bed rest. Answer: C. Providing clear liquid diet initially. Rationale: a clear liquid diet is recommended initially to rest the bowel and reduce symptoms. Question 6. Patient and family education. Which teaching point is essential for a patient with a history of diverticulitis to prevent future episodes? A. Avoid all nuts and seeds. B. Increase fiber intake gradually. C. Consume low-fiber diet permanently. D. Avoid physical exercise. Answer: B. Increase fiber intake gradually. Rationale: gradually increasing fiber intake can help prevent the formation of new diverticula and reduce the risk of future episodes. Question 7. Complications and their management. A patient with diverticulitis develops a colonic abscess. What is the appropriate nursing action? A. Continue with oral antibiotic therapy. B. Monitor for signs of septicemia. C. Prepare the patient for colonoscopy. D. Encourage high-fiber foods. Answer. B. Monitor for signs of septicemia. Rationale: a colonic abscess can lead to septicemia, requiring close monitoring and potentially more aggressive treatment. Question 8. Use of diagnostic tools. Which diagnostic tool is most appropriate for confirming a suspected case of diverticulitis? A. Abdominal ultrasound. B. Colonoscopy. C. CT scan of the abdomen. D. MRI of the abdomen. Answer. C. CT scan of the abdomen. Rationale: a CT scan is the most effective diagnostic tool for confirming diverticulitis, showing inflammation and complications. Question 9. Case study-based scenario. A 58-year-old male presents with acute left lower quadrant pain and fever. His past medical history includes diverticulosis. Which finding on a CT scan would confirm diverticulitis? A. Thickened bowel wall with paracolic fat stranding. B. Presence of colonic polyps. C. Hepatomegaly. D. Enlarged mesenteric lymph nodes. Answer. A. Thickened bowel wall with paracolic fat stranding. Rationale: thickened bowel wall with paracolic fat stranding is characteristic of diverticulitis on a CT scan. Question 10. Communication with healthcare providers. When discussing a patient with suspected diverticulitis with the healthcare provider, which information is most critical to include? A. Recent travel history. B. Presence of abdominal tenderness and fever. C. Current diet and exercise routine. D. History of allergies. Answer. B. Presence of abdominal tenderness and fever. Rationale: the presence of abdominal tenderness and fever is crucial information for diagnosing diverticulitis and deciding on the appropriate treatment. Question 11. Pathophysiology of diverticular disease. Which of the following statements accurately describes the pathophysiology of diverticular disease? A. Diverticular disease is primarily an inflammatory bowel disease. B. Diverticula form due to weaknesses in the bowel wall. C. Diverticular disease is caused by viral infections. D. The disease always involves the entire colon. Answer. B. Diverticula form due to weaknesses in the bowel wall. Rationale: diverticula develop due to weaknesses in the bowel wall, often exacerbated by increased colonic pressure. Question 12. Initial assessment and signs/symptoms. A patient with chronic diverticulosis is most likely to report which symptom during a routine checkup? A. Persistent diarrhea. B. Recurrent episodes of abdominal pain. C. Significant weight loss. D. Jaundice. Answer. B. Recurrent episodes of abdominal pain. Rationale: recurrent episodes of abdominal pain, particularly in the left lower quadrant, are common in chronic diverticulosis. Question 13. Emergency interventions. What is the priority nursing intervention for a patient with severe diverticulitis who presents with signs of sepsis? A. Administering antipyretics. B. Starting intravenous fluids and antibiotics. C. Inserting a urinary catheter. D. Placing the patient on a low-fiber diet. Answer. B. Starting intravenous fluids and antibiotics. Rationale: the priority is to manage the sepsis by initiating intravenous fluids and antibiotics promptly. Question 14. Medication management. Which medication is most likely to be ordered for a patient with acute diverticulitis to manage pain? A. Ibuprofen. B. Morphine sulfate. C. Acetaminophen. D. Naproxen. Answer: B. Morphine sulfate. Rationale: morphine sulfate is often used to manage severe pain in acute diverticulitis, though its use should be monitored for potential side effects. Question 15. Nursing care plans. For a patient recovering from an acute episode of diverticulitis, what dietary recommendation should be included in the nursing care plan? A. Initiate a high-protein diet. B. Maintain a low-residue diet initially. C. Start a ketogenic diet. D. Implement a gluten-free diet. Answer: B. Maintain a low-residue diet initially. Rationale: a low-residue diet is recommended initially to decrease bowel irritation as the patient recovers. Question 16. Patient and family education. What is a critical point to include in patient education to prevent the recurrence of diverticulitis? A. Avoid all dairy products. B. Drink at least 2 liters of water daily. C. Limit physical activity. D. Take daily laxatives. Answer: B. Drink at least 2 liters of water daily. Rationale: adequate hydration is important to maintain normal bowel function and prevent constipation, which can exacerbate diverticulitis. Question 17. Complications and their management. Which complication should the nurse monitor for in a patient with acute diverticulitis? A. Gastroesophageal reflux disease. B. Bowel obstruction. C. Chronic fatigue syndrome. D. Hypertension. Answer: B. Bowel obstruction. Rationale: bowel obstruction is a serious complication that can arise from diverticulitis, requiring careful monitoring. Question 18. Use of diagnostic tools. What diagnostic tool is least likely to be used in the acute setting for a patient with suspected diverticulitis? A. CT scan. B. Colonoscopy. C. Abdominal X-ray. D. MRI. Answer: B. Colonoscopy. Rationale: colonoscopy is usually avoided in the acute setting due to the risk of perforation in inflamed tissues. Question 19. Case study-based scenario. A patient with a history of diverticulosis presents with acute abdominal pain and a fever of 101 degrees Fahrenheit. The CT scan reveals an abscess. What is the most appropriate initial treatment? A. Surgical resection of the affected area. B. Intravenous antibiotics and possible percutaneous drainage. C. Oral antibiotics and a high-fiber diet. D. Laparoscopic appendectomy. Answer: B. Intravenous antibiotics and possible percutaneous drainage. Rationale: initial treatment typically involves intravenous antibiotics and possibly percutaneous drainage to manage the abscess. Question 20. Communication with healthcare providers. A patient with diverticulitis is not responding to conservative treatment. What information is essential for the nurse to communicate to the healthcare provider? A. The patient's travel history. B. The patient's current medication regimen. C. The patient's response to dietary changes. D. The patient's vital signs and symptom progression. Answer: D. The patient's vital signs and symptom progression. Rationale: vital signs and symptom progression are crucial for assessing the patient's response to treatment and planning further interventions. Question 21. Pathophysiology of diverticular disease. What change in the colon is most associated with the development of diverticulosis? A. Thinning of the mucosal layer. B. Hypertrophy of the muscularis layer. C. Increased intraluminal pressure. D. Decreased colonic motility. Answer: C. Increased intraluminal pressure. Rationale: increased intraluminal pressure leads to the formation of diverticula in the colon. Question 22. Initial assessment and signs/symptoms. Which symptom is least likely to be associated with acute diverticulitis? A. Left lower quadrant pain. B. Fever. C. Constipation or diarrhea. D. Hematuria. Answer: D. Hematuria. Rationale: hematuria is not typically associated with diverticulitis. Common symptoms include left lower quadrant pain, fever, and changes in bowel habits. Question 23. Emergency interventions. For a patient with suspected perforated diverticulitis, what is the immediate nursing priority? A. Administer oral pain medications. B. Keep the patient NPO, nothing by mouth. C. Encourage ambulation. D. Administer a barium enema. Answer: B. Keep the patient NPO, nothing by mouth. Rationale: keeping the patient NPO is essential to prevent further bowel contents from spilling into the peritoneum. Question 24. Medication management. Which medication should a nurse anticipate administering for a patient experiencing severe pain from acute diverticulitis? A. Oral ibuprofen. B. Intravenous morphine. C. Oral acetaminophen. D. Topical lidocaine. Answer: B. Intravenous morphine. Rationale: intravenous morphine is often used to manage severe pain in acute diverticulitis cases. Question 25. Nursing care plans. In a patient with acute diverticulitis, what is a primary nursing diagnosis? A. Risk for electrolyte imbalance related to chronic diarrhea. B. Risk for fluid volume deficit related to NPO status. C. Risk for skin breakdown related to immobility. D. Risk for infection related to surgical intervention. Answer: B. Risk for fluid volume deficit related to NPO status. Rationale: patients are often kept NPO, which increases the risk for fluid volume deficit, requiring careful monitoring and management. Question 26. Patient and family education. Which dietary advice is appropriate for a patient recovering from an acute episode of diverticulitis? A. Follow a low-fiber diet until symptoms resolve. B. Resume a regular diet immediately. C. Avoid all fruit and vegetables. D. Only consume clear liquids permanently. Answer: A. Follow a low-fiber diet until symptoms resolve. Rationale: a low-fiber diet is recommended during recovery to reduce bowel irritation. Question 27. Complications and their management. A patient with diverticulitis is at increased risk for developing which serious complication? A. Peptic ulcer disease. B. Intestinal perforation. C. Cholecystitis. D. Appendicitis. Answer: B. Intestinal perforation. Rationale: intestinal perforation is a serious complication of diverticulitis that can lead to peritonitis and sepsis. Question 28. Use of diagnostic tools. Why is a colonoscopy typically avoided during an acute episode of diverticulitis? A. It is not an effective diagnostic tool. B. It can exacerbate inflammation and increase the risk of perforation. C. It does not provide clear imaging of diverticula. D. It is contraindicated in patients over 60. Answer: B. It can exacerbate inflammation and increase the risk of perforation. Rationale: colonoscopy during an acute episode can increase the risk of perforation due to inflamed tissues. Question 29. Case study-based scenario. A 70-year-old female with a history of diverticulosis presents with acute lower abdominal pain and a temperature of 102 degrees Fahrenheit. A CT scan confirms diverticulitis with a small paracolic abscess. What is the most appropriate initial treatment? A. Intravenous antibiotics and observation. B. Immediate surgical intervention. C. High-fiber diet and oral antibiotics. D. Laxative administration and bed rest. Answer: A. Intravenous antibiotics and observation. Rationale: initial treatment includes intravenous antibiotics to manage the infection and observation to monitor for changes. Question 30. Communication with healthcare providers. In reporting a case of suspected diverticulitis to the healthcare provider, which patient information is most critical? A. The patient's recent dietary habits. B. The patient's family history of gastrointestinal disorders. C. The patient's medication history. D. The patient's current symptoms and physical assessment findings. Answer: D. The patient's current symptoms and physical assessment findings. Rationale: current symptoms and physical assessment findings are essential for diagnosing and determining the appropriate treatment plan. Question 31. Pathophysiology of diverticular disease. Which factors contribute to the formation of diverticula in the colon? A. Low-fiber diet and chronic constipation. B. High-fiber diet and frequent diarrhea. C. Chronic alcohol consumption. D. Regular exercise. Answer: A. Low-fiber diet and chronic constipation. Rationale: a low-fiber diet and chronic constipation increase colonic pressure, contributing to diverticula formation. Question 32. Initial assessment and signs/symptoms. During an assessment of a patient with suspected diverticulitis, which finding would be most concerning? A. Left lower quadrant pain and tenderness. B. Mild fever and chills. C. Blood pressure of 150/90 mm of mercury. D. Rebound tenderness and guarding. Answer: D. Rebound tenderness and guarding. Rationale: rebound tenderness and guarding indicate peritonitis, a serious complication requiring immediate medical attention. Question 33. Emergency interventions. For a patient with acute diverticulitis and signs of peritonitis, what is the nurse's immediate action? A. Administering oral antibiotics. B. Preparing for surgical intervention. C. Encouraging fluid intake. D. Administering a cleansing enema. Answer: B. Preparing for surgical intervention. Rationale: peritonitis requires prompt surgical intervention to address the underlying cause and prevent sepsis. Question 34. Medication management. Which class of medications should the nurse anticipate for a patient with acute diverticulitis to manage pain? A. NSAIDs. B. Opioids. C. Antidepressants. D. Anticonvulsants. Answer: B. Opioids. Rationale: opioids are commonly used for severe pain management in acute diverticulitis. Question 35. Nursing care plans. What is a key nursing intervention for a patient with acute diverticulitis who is NPO? A. Providing parenteral nutrition. B. Administering oral supplements. C. Encouraging high-protein snacks. D. Monitoring for signs of dehydration. Answer: D. Monitoring for signs of dehydration. Rationale: patients who are NPO are at risk for dehydration, requiring close monitoring and appropriate interventions. Question 36. Patient and family education. Which lifestyle modification should a nurse emphasize to a patient with diverticular disease to prevent recurrence? A. Avoiding all spicy foods. B. Increasing dietary fiber intake gradually. C. Limiting physical activity. D. Consuming a liquid diet permanently. Answer: B. Increasing dietary fiber intake gradually. Rationale: gradually increasing dietary fiber can help prevent the recurrence of diverticulitis by promoting regular bowel movements. Question 37. Complications and their management. What is a potential complication of untreated diverticulitis? A. Colon cancer. B. Fistula formation. C. Ulcerative colitis. D. Irritable bowel syndrome. Answer: B. Fistula formation. Rationale: untreated diverticulitis can lead to complications such as fistula formation between the colon and other organs. Question 38. Use of diagnostic tools. Which diagnostic tool is most useful for evaluating complications of diverticulitis? A. Barium enema. B. CT scan. C. Colonoscopy. D. Abdominal ultrasound. Answer: B. CT scan. Rationale: a CT scan is highly effective for identifying complications such as abscesses, fistulas, and perforations in diverticulitis. Question 39. Case study-based scenario. A 60-year-old male with a history of diverticulitis presents with severe abdominal pain, fever, and chills. What initial intervention should the nurse anticipate? A. Administering a barium enema. B. Initiating IV antibiotics and fluids. C. Encouraging a high-fiber diet. D. Performing an abdominal massage. Answer: B. Initiating IV antibiotics and fluids. Rationale: initial intervention includes starting IV antibiotics and fluids to manage infection and prevent dehydration. Question 40. Communication with healthcare providers. What information should the nurse prioritize when calling the healthcare provider about a patient with acute diverticulitis? A. The patient's response to previous treatments. B. The patient's occupation. C. The patient's recent travel history. D. The patient's allergy status. Answer: A. The patient's response to previous treatments. Rationale: the patient's response to previous treatments is crucial for the healthcare provider to decide on the next steps in management. Question 41. Pathophysiology of diverticular disease. What physiological change in the colon is directly related to the development of diverticulosis? A. Decreased mucosal blood flow. B. Increased muscular hypertrophy. C. Elevated intraluminal pressure. D. Enhanced colonic peristalsis. Answer: C. Elevated intraluminal pressure. Rationale: elevated intraluminal pressure contributes to the formation of diverticula by causing herniation of the mucosal layer through weaknesses in the colon wall. Question 42. Initial assessment and signs and symptoms. Which clinical finding is most characteristic of acute diverticulitis? A. Epigastric pain radiating to the back. B. Right lower quadrant pain and nausea. C. Left lower quadrant pain and tenderness. D. Generalized abdominal distension. Answer: C. Left lower quadrant pain and tenderness. Rationale: left lower quadrant pain and tenderness are characteristic findings in acute diverticulitis, as most diverticula are located in the sigmoid colon. Question 43. Emergency interventions. For a patient with suspected perforated diverticulitis, what is the immediate nursing action? A. Starting oral antibiotics. B. Administering intravenous fluids and antibiotics. C. Encouraging the patient to walk. D. Providing a high-fiber diet. Answer: B. Administering intravenous fluids and antibiotics. Rationale: immediate administration of IV fluids and antibiotics is crucial to manage sepsis and prepare the patient for potential surgical intervention. Question 44. Medication management. A patient with acute diverticulitis is prescribed metronidazole and ciprofloxacin. What is the purpose of these medications? A. To reduce inflammation in the colon. B. To manage severe pain. C. To treat the underlying infection. D. To relieve constipation. Answer: C. To treat the underlying infection. Rationale: metronidazole and ciprofloxacin are antibiotics used to treat the infection associated with acute diverticulitis. Question 45. Nursing care plans. For a patient on a clear liquid diet due to acute diverticulitis, what nursing intervention is essential? A. Encouraging increased physical activity. B. Monitoring for signs of nutritional deficiency. C. Providing high-protein supplements. D. Administering laxatives regularly. Answer: B. Monitoring for signs of nutritional deficiency. Rationale: patients on a clear liquid diet are at risk for nutritional deficiencies and need close monitoring. Question 46. Patient and family education. Which advice is most important for a patient with a history of diverticulitis to prevent recurrence? A. Avoiding all dairy products. B. Gradually increasing dietary fiber. C. Limiting water intake. D. Taking daily antacids. Answer: B. Gradually increasing dietary fiber. Rationale: gradually increasing dietary fiber helps maintain regular bowel movements and prevents the formation of new diverticula. Question 47. Complications and their management. A patient with diverticulitis is being monitored for potential complications. Which complication is most likely? A. Liver abscess. B. Bowel obstruction. C. Pancreatitis. D. Gallstones. Answer: B. Bowel obstruction. Rationale: bowel obstruction is a common complication of diverticulitis due to inflammation and scarring. Question 48. Use of diagnostic tools. Why is a CT scan preferred over a colonoscopy during an acute diverticulitis episode? A. It is less expensive. B. It provides better imaging of the bowel wall and surrounding tissues. C. It is non-invasive. D. It is faster. Answer: B. It provides better imaging of the bowel wall and surrounding tissues. Rationale: a CT scan offers detailed imaging of the bowel wall and surrounding tissues, helping identify inflammation and complications without risking perforation. Question 49. Case study-based scenario. A 65-year-old female presents with severe left lower quadrant pain and a fever of 102 degrees Fahrenheit. The CT scan shows diverticulitis with microperforations. What is the initial treatment plan? A. Oral antibiotics and bed rest. B. Intravenous antibiotics and bowel rest. C. High-fiber diet and laxatives. D. Immediate surgical intervention. Answer: B. Intravenous antibiotics and bowel rest. Rationale: initial treatment for diverticulitis with microperforations includes intravenous antibiotics and bowel rest to manage the infection and inflammation. Question 50. Communication with healthcare providers. When reporting a case of acute diverticulitis to the healthcare provider, what information is most critical to convey? A. The patient's dietary preferences. B. The patient's physical assessment findings. C. The patient's exercise routine. D. The patient's social history. Answer: B. The patient's physical assessment findings. Rationale: physical assessment findings provide essential information for diagnosing and determining the appropriate treatment for acute diverticulitis.